We're presenting data here based on an Optum database retrospective analysis of high-risk patients. We took about 11,000 patients who either have diabetes or atherosclerotic cardiovascular disease or both, and we asked a very simple question. If a patient has triglycerides of 200 to 499 and you compare them to patients whose triglycerides are less than 150 with an HDL above 40, so they don't meet criteria for metabolic syndrome, by way of example, is there a difference in cardiovascular outcomes over about a 4-year follow-up period? Everyone in the study was on a statin, and I'm happy to say that half of all the patients were women, half were men, so both sexes are well represented. And over the course of the follow-up period, we found that for the patients who had the hypertriglyceridemia, the risk of sustaining an acute cardiovascular event, so all MACE, was increased by about 35%. The risk of sustaining a non-fatal MI increased 34%. The risk of a non-fatal stroke, 27%. The risk of requiring revascularization via PTCA or CABG was 51% higher in the patients whose triglycerides were just over 200. And the other important thing was that if you had hypertriglyceridemia, your average monthly health-related costs increased 14%, and if you were hospitalized 17% longer. Now, in a related way, just having diabetes increased your monthly health-related cost by about 43% and increased any hospitalization cost 45%. Now, what I'm very happy to report here is that the relationship between the elevation in triglyceride and augmented risk for cardiovascular events actually held even after adjusting for LDL cholesterol, non-HDL cholesterol, and HDL cholesterol. And this is one of the very first studies to demonstrate that. So truly, triglycerides did emerge as an independent predictor of future cardiovascular events. And we pose the argument that this explains to some degree why there continues to be residual risk, as you observe in studies like Prove It, where having a triglyceride level above 150 was actually associated with a 27% higher residual risk for sustaining an acute cardiovascular event. So basically, we've got LDL licked because we can just about take it to ridiculously low levels, less than 25, in some patients even less than 10. But there's still a signal for risk in trials like Fourier and Odyssey outcomes. So where else is risk coming from? Well, obviously, if you're diabetic, there's risk coming from diabetes. There's risk coming from poorly controlled hypertension if you're still a smoker, etc. But we do believe that the triglycerides are significantly contributing to what we call residual risk.